Are you in your 20s or maybe even less than that and looking for hair transplantation? Then do make sure that the clinic you're talking to will take into account your age. It's quite important that when you opt for hair transplant, that your present age, your present hair loss, and the expected, anticipated future hair loss is taken into consideration. It's not fair to do the same surgery on a 22-year-old as a 50-year-old. You need to take into account what the patient's age is. And ignoring age is really not an option. It should not happen. I've had too many patients that when they were frustrated with their hair loss at, say, in their early 20s, went to a clinic, had a very good offer, and then for the rest of their life they can spend regretting it because at age 22, 25, they had grafts placed in the crown, and now they're realizing that it wasn't really a good option. Or if they had a very low hairline that is now bothering them at the age of 30, 35. So you have to take age into consideration. Generally speaking, I prefer to keep a very conservative hairline. If the patient is less than 30 years old, I'd happily do a transplant on someone who's less than 30. But I want the hairline to be conservative, relatively high, not too low. And I usually or very rarely do hair transplantation to the crown in patients that are less than 35 years of age. We need to take into account how old the patient is, what is the present hair loss, and what do we anticipate would be the situation another 5, 10, 15, 20 years from now. We do have a video on hair transplantation in the young. You can check it out and you can have more details about why it is and how it is that we deal with patients the way we do. Thank you.